Before you choose a Medicare plan, you need to understand how Medicare really works because the wrong decision can cost you thousands. Welcome to Medicare 101. This is a Medicare readiness webinar designed to walk you through the basics of Medicare and help you feel more confident before you ever have to make those important decisions. My name is Nicole Morgan. I'm a licensed insurance agent and the owner of Morgan Medicare Solutions. I also bring more than 20 years of experience in healthcare as a licensed clinician. That clinical background allows my team and me to take a more holistic approach, looking not just at insurance plans, but how your coverage supports your healthcare needs both now and in the future. At Morgan Medicare Solutions, we believe education comes first. It's incredibly important to understand what you're enrolling in, why you're enrolling in it, and how your plan actually works and what it will cost you when you need to use it. Medicare mistakes can be costly, and choosing the wrong plan often doesn't matter until it matters most. This webinar will likely spark questions, and that's a good thing. If you have questions, we're here with answers. Our services are always provided at no cost to you. We assist you with everything from Medicare sign-up to plan enrollment and ongoing support year after year. We are an independent health and life insurance agency operating in multiple states, and we are not affiliated with any government agency. Our practice model is simple: education first, client-centered planning, and ongoing lifetime service. We do the research for you and help you choose the plan that best fits your needs and remain your trusted resource as your situation or coverage needs change. Because we don't work for Medicare, we work for you. Here's what we will cover. We're going to learn today how and when to enroll in Medicare, parts of Medicare and what they cover, Medicare mistakes, how to avoid them, Medicare options, policies to fill in the gaps of Medicare cost, and working with a trusted broker. Let's talk about how and when to enroll in Medicare. Before you actually enroll in Medicare, here are some helpful hints. These are some things that you need to do before you enroll and then after you enroll and have your Medicare ID number. The first thing anyone needs to do, and they can do it at any time, is set up a Social Security account at ssa.gov. Everyone needs to set this account up. Do not wait until you actually need to apply. Actually do it well before if you don't have an account set up, because it's very restricted in verifying your identity. You want to get through all of those hurdles before you actually apply for Medicare, because that could be a hiccup and cause some stress. So set up that account, learn your login, learn how to log in. It is a hub where you can check your Social Security earnings. You can also apply for Medicare through this account, and you can follow up when you do apply. You can follow up with your application. Now, once you have signed up for Medicare and you have your Medicare ID number, then you need to sign up for a Medicare.gov account. You do this with your Medicare ID, and this is the hub that you can check your Medicare claims. If you're on Original Medicare, you can save your drug list. You can enter your drugs in your pharmacy that you used. You can also check different plans. You can also check cost of different plans with your drugs in them. So once you have your Medicare ID, you need to set up a Medicare.gov account. Before you actually apply for Medicare, you need to set up a ssa.gov account, a Social Security account online. When someone turns 65, they have an initial enrollment period. It's 3 months before your birthday month, your birth month, and then 3 months after. If someone's collecting Social Security prior to the age of 65, they're automatically going to be signed up for Medicare Parts A and B, and it will start the first day of their birth month. Medicare always starts at the first of the month. If someone has a birthday, like example, April the 1st, then their whole 7-month window of signing up will shift up by a month, and their Medicare will actually start March the 1st. If you are not collecting Social Security before the age of 65, then you are going to have to sign up for Medicare through your ssa.gov account. You can call Social Security and set up an appointment with them by phone, or you can call and set up an appointment in person. However, those appointments take very long to get. So the easiest way to sign up for Medicare is through your Social Security account online. Suggestion is if you plan to go on Medicare when you're 65, and that's going to be your primary coverage, then you need to apply in the first 3 months before your 65th birthday. That way, your Medicare will start on the first day of your birth month, and all of the plans that you choose will start that day as well. A lot of the myths out there and the pressure is you've got to sign up for Medicare when you're 65 or you will get a penalty. Well, this all depends on your situation. Are you working for a large group health? Is it over 20 employees? Is your drug coverage on that healthcare plan credible with Medicare, meaning that it provides equal or greater coverage than Medicare or better coverage than Medicare would provide? If that is the case, then you can delay your Medicare altogether without a penalty. And yes, let me say it again. If you're working past 65 and you're on a large group over 20 employees healthcare plan, you can delay your Medicare with no penalty. Some people choose to sign up for Part A and then decline Part B because they are still working and covered by a credible group health coverage. The other thing is if someone is not contributing to an HSA, that is another sign that they can sign up for Part A and decline Part B. But if someone is contributing to an HSA, a health savings account through their employer, they cannot be on any part of Medicare. If you do this, then you can contribute to your HSA while you're on Medicare as well, then you could get a tax penalty later. Now, when you come off of that group health and you come onto Medicare, you are going to have to provide proof of employment. And that form is called the CMS L564. And that form is signed by your HR, your benefits person in where you work. This little form will waive all your penalties. And so that just proves to Medicare, Social Security that you've been covered since you've been 65. The best time to kind of get all of this, because there's a lot of moving parts. When you're coming off of group health, there's a lot of moving parts. There's people to communicate with, there's planning to be done, there's education to be done. So it can be really overwhelming. It cannot all be done sometimes in one appointment for you to grasp all of the education that you're about to get. You'll probably be more involved in your Medicare insurance than you ever were in your group health. And so that's why it's really important to meet with an expert on Medicare, maybe a really experienced broker like myself, to about 2 to 3 months prior to your last date of employment of your healthcare coverage, because that will give you enough time to plan out your retirement, plan when you need to apply for Medicare, make sure you have that Medicare number, choose your option of Medicare, and get enrolled once you have that number. But a lot of people really don't know which option is better. Is it better for you to stay on your group health, or is it better for you to go to Medicare? So when you come to that crossroads, when you turn 65, that's another time to meet with a broker and talk to them, a Medicare expert, to say, okay, let's compare it. Let's compare what it's going to cost me on group health versus what it's going to cost me on Medicare. Who am I covering on that group health? Can they get another insurance plan? All of this is good conversation, is smart conversation, wise conversation to help you make the best choice for you, whether to go onto Medicare or to not. Timing is everything. Planning ahead is so critical. I cannot stress that enough. Medicare, Social Security, it's not Amazon Prime. It doesn't happen in 24 hours most of the time. So you're going to have to wait. So just make sure you plan ahead. Now let's talk about the parts of Medicare. There are 4 parts. Part A is your hospital insurance. Part B is your medical insurance. Part C is the Advantage plan, the Medicare replacement, and Part D is your prescription drug coverage. Part A is your hospital coverage. This also includes skilled nursing, home health, and hospice. This part of Medicare has no premium if you qualify. How do you qualify? Well, you have worked 10 years, 40 quarters, paid your Medicare taxes for that amount of time, then you would qualify for premium-free Part A. It doesn't cost you anything. It does have a deductible, though. It has a first-day hospital deductible of $1,736. And then if you stay in the hospital 60 days and beyond, it can cost you all the way to the end up to $868 a day. Skilled nursing, if you stay beyond 20 days, could have a copay of $217 per day. Well, that is a definite hole in Medicare cost, and we need to fill that with the right plan. Medicare Part B is your medical insurance. That is all of your doctor visits, all of your outpatient, your tests, procedures. This part of Medicare only covers 80% of your costs. That leaves you a 20% gap. It's 20% coinsurance without a limit. So when you think of catastrophic diagnosis like heart attack, stroke, cancer, now Alzheimer's, some of those diagnoses that you are going for tests all the time, you're going to the doctor all the time, maybe outpatient therapy. Nobody wants to have 20% coinsurance without a limit. So that is a hole in this if you just have Medicare, and we want to fill it with the proper plan that meets your needs. Part B also has an annual deductible. The annual deductible can change every year, and this year it is set at $283. It does have a monthly premium, so this part of Medicare you will pay for, and it is based on your adjusted gross income from 2 years ago. Now, the standard rate, now that we're in 2026, is $202.90 a month. That is what the majority of the general public will pay, is $202.90 a month. Higher incomes will pay an IRMA, which is an income-related monthly adjustment amount. They will pay an adjustment on Part B and Part D. So high earners will get hit with two parts of Medicare, B and D. Each year, this IRMA and each year, all of the Medicare premiums are adjusted, okay? But they're always going to look back 2 years. So in 2026, if you're planning to turn 65 and go on to Medicare, 2 years, they're looking back, 2024, at your modified adjusted gross income. And if it is over the standard amount, then you will pay more on your Part B and D. I wanted to show you a little bit of what that would look like. These are Part B premiums for 2026 and the IRMAs, the income-related monthly adjustment amount. We always say this IRMA is not very nice, and she feels like a penalty to some of our high earners. But you can see this is a chart that Medicare does not put out. It is a chart that Medicare has, but I modified it a little bit so that the breakdown is a little bit easier to understand. But most people will be filing their taxes jointly, but there is a joint income to follow, and then there's also an individual tax return. Okay, so if you file your jointly, there's a standard threshold. The standard is $218,000 or less. And then if you file single, then it's $109,000 and less. And then you'll pay the standard rate $202.90, and you will not pay an adjustment on whatever your Part D. So these adjustments are added to the premium, the standard premium. And you can see in this chart the breakdown of what the adjustment is. So for example, if you are at a level 2 or the next level up from the standard, you can see that there is an adjustment of $81.20 that's added to the standard rate, $202.90, bringing you to a monthly premium for Medicare of $284.10. On top of that, for your D, your adjustment on Part D, you will pay an additional to whatever that premium is on your Part D. you're going to pay an additional $14.50. So all of these numbers, this is why working with an expert each year or doing your due diligence each year is necessary, because all of these numbers will change every year. But as for the Part B premiums, and the way that they know what you're going to pay is they get with the IRS and they look back 2 years. There are certain situations in which a person can appeal. If they have a high IRMA, there are certain situations that they can appeal. And we help guide people on knowing which situation they fall into and if it's possible that they could win an appeal. It's not always a guarantee. They have to fit a qualifying event in order to appeal the Part B premium. Part C in itself is an option of Medicare that we're going to talk about in a little bit greater detail later, but it is the Medicare replacement. It is known as the Advantage Plan. These are the plans that you see on TV all the time. This is an actual part of Medicare, Part C. They are called Advantage plans. They are insurance plans that are subsidized by Medicare. So Medicare is paying them a set amount of money to take care of you. This is managed care. They have Part A, they have the benefits of Part A, which is hospital, and Part B, all of your outpatient of Medicare. They have that. And you have to be enrolled in Part A and Part B and pay your Medicare Part B premiums, okay? So they include all of these benefits of Part A, hospital, Part B, medical. Most of them include drug coverage, plus they have additional benefits included in that plan. They're an all-inclusive plan, similarly structured like your group health plan, okay? These are an insurance, so an insurance carrier is going to be paying those claims. They are network driven. They are either HMOs or PPOs, and there are certain plans that are available in your county or your state, and not every county is the same. So they're all county and region specific. They can be changed though. Every year, without any health questions, they can be changed October 15th through December the 7th. That is known as the Medicare annual enrollment period. That's the time frame you get to change. All of the changes that you make during that time frame will go into effect January 1. And then you also have another time frame on a Medicare Advantage to change your plan one time, and that is from January 1st through March the 31st. That's the Medicare Advantage open enrollment period. That's when people can change their Advantage plan. You have to answer no health questions to get an Advantage plan. And if you change from Advantage plan to Advantage plan, there are no health questions asked. Part D drug plans are required by Medicare. If you don't get one when you first are eligible for one, then you could start getting a penalty. And you're going to get a penalty for every month you go without. And so it is in your best interest, whether you take no drugs or a lot of drugs, or whether you can just buy all of your drugs through a good RX or through Mark Cuban's Cost Plus drugs or some discount, you need to have a Part D drug plan. These can also be changed every year without any health questions during October 15th through December the 7th. Every one of them is different. They have different premiums. They have different deductibles. They have different formularies. Those are the drugs that are on each plan. So the generic medications are typically a lower cost. Brand name medications can get very expensive. There are 3 different ways that you can get a drug plan. You can get one through an Advantage plan. You can get a standalone drug plan through a contracted insurance carrier. Or if you are a veteran, you can get your medications through the VA without a penalty. Medicare.gov is a decent has a decent drug analysis search tool. So we talked in the beginning how important it is to have a Medicare.gov account when you have your Medicare ID. So this is the place where you can go and you can actually look at all the drug plans that are in your available area. and you can compare cost on this drug analysis tool. Now that we have we've kind of discussed really briefly the parts of Medicare. And now we want to discuss, what do we do next? Now we have to choose an option. Well, there are only two options out of all the insurance companies that are out there promoting and pushing Medicare plans. There are only two options that you can actually choose as your package of protection. The first option is you can choose Original Medicare. You can stay with Original Medicare and have Medicare Part A, your hospital, and Part B be the primary payer. Well, you have to get a Part D for your drug plan. That's your prescription drug coverage. And then to fill in that 20% gap that we talked about earlier on Part B, you get what's called a Medigap plan or supplemental insurance. And so that gives you right there your basic package. So that's one option. Then on the other hand, you can choose the Advantage plan, the Part C, the Medicare replacement, that has the benefits of Part A, hospital, Part B, medical, and then you have included on most plans Part D, prescription drug coverage. So these are the only two options that you can choose with a Medicare plan, and now we're going to do a deep dive into those. We'll take the first option, Original Medicare. That's where you have Part A plus Part B plus Part D plus your Medigap or your supplemental coverage. Medigap plans or supplemental, I use those terms interchangeably. They're private insurance plans that work with Medicare. They're not contracted with Medicare. They are controlled by the state insurance department. They do act as a secondary to Medicare A and B, okay? A plan, there's lots of plans with different letters, but the two that we're going to talk about the most right here, the ones that are most popular, are a Plan G, which pays the full 20% after you pay the Medicare Part B annual deductible. Once you have paid that, then your Plan G covers the full 20%. You have no copays on this plan. A Plan N pays the full 20%, again, after you have met the annual deductible for the year, but then you have a $20 copay at the doctor's office and a $50 copay at the emergency room. A Plan N has a lower premium than a Plan G does, and it matters where you live, in your state, and your zip code as to what premiums these insurance companies will set for you. All Medigaps with the same letter provide the same coverage between these carriers. So every Plan G that's available they'll all pay the full 20% after you meet the Medicare deductible. All Plan Ns will cover the same. All these different companies will provide the same exact coverage. They're all standardized, okay? You get the first 6 months you're on Medicare, this is your free look. This is your window of opportunity to get a Medigap with no health questions asked. So it is call it the Medigap enrollment period. The first 6 months that you are on Medicare Part B, you can get a Medigap plan with no health questions asked. If you decide to wait longer than that for whatever reasons, if you want a Medigap plan after that, then you will be underwritten and you have to answer health questions. And at that point, it is not a guarantee that you will be approved by that supplemental insurance company. With these kinds of plans, there are no networks. There's no referrals needed. You can see any doctor, any provider that accepts Medicare. So when you're calling the doctor, you're going to ask them, do you take Medicare? And then if they do take Medicare, they accept what Medicare pays them, then they will take your Medigap plan. It doesn't matter what company it's with, it operates as a secondary. Part D is the standalone drug plan that is added for drug coverage. Now this one, remember, is required by Medicare, even if you do not take any medications. Other policies that we typically add for more protection that are not covered by Medigap is dental, vision, and hearing. Medicare does not cover any part of dental. They only cover a screening for hearing, and they don't cover routine vision for your glasses. We also offer cancer plans and home care plan. Those are other little holes that could cause some real big expenses in Medicare that Medicare doesn't cover. Yes, Medicare will cover cancer, but cancer is one of the most expensive diagnoses, and cancer plans are often available to help offset some of the cost of what Medicare won't cover. Expensive meds, to be as an example. Home care, those are policies Medicare doesn't cover for a caregiver to come to your home and for that non-medical care. So home care plans are provided, or you can apply for those to help offset some of that caregiving expense because that is out of your pocket. So when I talked about that all Plan Gs or all Plan Ns are all equal in coverage, this is kind of what it's like. It's like apples to apples. But the price on each of these plans are going to be different. It's going to be different per company. It's going to be different where you live and your zip code. But the coverage is all the same. The Medicare Advantage plan is your other option that you can choose, and that is Part C. These are private insurance plans subsidized by Medicare, so your health care costs are controlled and your premiums per month can be lower. There are maximum out-of-pockets that you would have to meet before these plans ever pay 100%, and those max out-of-pockets can be in the thousands. These plans, these insurance companies have to follow Medicare rules and guidelines, okay? So they can't ask any health questions. They have to cover what original Medicare covers, and they have to be approved every year by Medicare. These plans have to be approved. They are HMOs or PPOs. Let me say that again. They are HMOs or PPOs. They have doctor networks. They have copays for services like specialist visits. They have copays for medical tests most of the time. They've got copays for hospital stays. There is a maximum out of pocket to meet, and that can be in the thousands. Some of them even have medical deductibles applying to some services. So the premiums on these plans are, some of them have no premiums and some of them have low premiums. They do provide extra benefits in some of these plans as well. Most of the plans already include drug coverage, so you don't have to get something else. Again, just a refresher, they do include the benefits of hospital Part A, medical Part B, drug coverage Part D. They can be changed during October 15th through December the 7th, or from January 1 through March the 31st every year, no health questions asked. Someone must have enrolled and have active Part A and Part B of Medicare in order to get this Advantage plan. Here is what it looks like when you choose an Advantage plan. It's like fruit basket turnover. It is every plan that is even offered by one insurance carrier can look like this. Every plan is different. Every plan has different premiums. Every plan has different copays. Every plan has different doctor networks. Do all doctors take this plan? No. We'll talk about that in the very end. But it's very, very important when someone chooses an Advantage plan to do proper research on medications, cost of medications with each individual plan, what's available in their area. Does the doctor that you go to, do they take this plan? Very, very important to do proper research because you certainly don't want to enroll in a plan that your doctor doesn't even take. So you must do proper research before you enroll in a plan like this. Additional protective policies that we add to either original Medicare or the Advantage plan are the dental, vision, and hearing, the cancer, heart attack, and stroke policies, a hospital indemnity, skilled nursing policy, and then home care. These are all additional protective policies that you can get to add to your basic coverage or your package of protection. So these kinds of plan would complete your package of protection, making sure that you are covered in all areas of your health, and for now and for the future. Here's the thing, deciding on a plan can be difficult. There is a lot, as you can see, in this just this little video of how much information is floating out there. How much do you need to know? How it can be very, very overwhelming. So we want to decide, and in our conversation, how important is it to keep your own doctors? Do you live in a rural area? Do you live in a big metroplex? What's available to you? Big thing too, what's your budget? Have you even thought about your budget in healthcare? And sometimes you can't compare the budget with group health into what you're going to pay for Medicare because everyone is an individual in Medicare. And on group health, your company pays a portion of those premiums. And so, people don't really think about, well, how much can I spend on healthcare in retirement? Other things that we need to think about is how flexible do you want this plan? Do you want to go to wherever the plan tells you to go, or do you want to be able to decide your own doctors? Another thing is, do you take multiple medications? That can be an expensive. We can't help that sometimes that we take multiple medications, but sometimes that's our biggest expense. And so, how do we protect ourselves, and what plan do we need to choose when we have all of this going on? How important are the extra benefits to you? We're not going to get into the details of what the extra benefits are on some of these plans, but what are you looking for? It's really important to narrow down what you need for your health care and what you want to pay for it. How important is it to you? We're in retirement now, and we have let our employers, our HR benefits, and all of that has been, kind of decided for us. But now we're in a different phase of life. We're in retirement, and we're going to be more involved. You're going to be more involved in your health care and your healthcare plan each year, more than you probably ever wanted to be. But there's a lot of factors that go into deciding on which plan is most important for you and the best fit for you. But there's some things that they don't tell you when you're deciding a plan. And this is what we want to know before you even have to make any decision. Not all doctors will take Medicare. Some doctors won't take you when you're 65. It's really, really important to check with your doctor and to make sure that they're going to take you when you are on Medicare, and to also find out from that insurance specialist at the doctor's office, the one that handles the benefits, what kind of Medicare plans do they take? And when I say that, I mean, do they just take original Medicare? Do they take original Medicare and some Advantage plans? What carriers do they have? That's information that's good for you and good for your knowledge to know what your doctor does take. If you're working and let's say you retired and then they offered you COBRA, COBRA is not considered credible employer group health. One, because you're not working anymore. And so Medicare only gives you 8 months of COBRA. In most companies will give you 18 months, but Medicare says that you only get 8 months, and if you stay on it longer than 8 months, you're going to get a penalty. So COBRA is really not considered credible. So that's another situation that always has to be talked out. And what are the best options? Who needs coverage in Medicare? Who needs coverage in private health insurance? The other thing we addressed earlier is that if someone is contributing to a health savings account, they cannot be on any part of Medicare. You could get a tax penalty. Another thing is that if you are contributing, you can definitely use that money that you have contributed while you're on Medicare, but you just can't contribute while you're on any part of Medicare. And Medicare suggests that you stop contributing 6 months. If you're over 65, let's clarify that. If you're over 65 and you're working and you want to contribute to an HSA, and then you're going to go on Medicare, you need to stop contributing 6 months prior to you applying for Medicare so that you don't get a penalty in your taxes. Timing is everything. You don't have to be a Medicare expert. You just need to know some basics. And that's what I'm hoping that this video provides for you, is some basics. But timing, planning, and knowing when you should enroll and knowing when you will get a penalty are super, super important. You know, mistakes to avoid. We do not want to have to pay more in retirement for a mistake that could have easily been avoided by just having the right kind of knowledge. So we don't want to miss any enrollment deadlines. We don't want to miss the Medigap enrollment period. We want to make sure that we get that guaranteed issue if that's the option that we choose. Okay, we do not. Okay, so let me just explain this. If you change jobs after you're 65, which happens all the time, the majority of my clients are working past 65, they're working longer, and they're changing jobs. Some of them are starting over in new careers. However, if you're over 65, you have to keep proof of credible coverage from one employer to the next, because you do not want to show any lapse of coverage. Why? Because you could get a penalty, and penalties with Medicare will follow you for life. So if you're changing jobs, even if you're leaving one job and going to Medicare after you're 65, over 65, you need to keep proof of credible coverage. What is the credible coverage form? It is called CMS L564. You can Google it, you can download it, we can provide it for you. We have a whole tutorial on how to fill that out and how to work with your HR and benefits coordinator to fill that out properly. Failing to review your coverage every year. Some people they just live life and they forget that Medicare changes every year. Well, we kind of put those changes out every year. Medicare, Social Security is going to update you on any changes as well, like premium changes and everything. But one of the things that's super important to evaluate, not only just is your plan, but I'm going to talk about this. I'm going to do a whole nother video on drug plans, but failing to review that every year, because premiums will change on these plans every year, and it's super, super important to review it. Review it with an expert. Have another expert helping you, making sure you're making the right decision year after year. Don't assume Medicare is free. It's not. It's going to cost you. It's going to be based on your adjusted gross income. They're always looking back 2 years. It doesn't cover everything. It doesn't cover home care, and I'm talking about home care that a provider coming to your home. It doesn't cover long-term care. It doesn't cover dental. It doesn't cover everything you are going to need as you get older in retirement. Another mistake is not understanding how Medicare Part B is billed and how you pay for it. I have had people not understand that and miss a bill, and then they lose their Medicare. All of these mistakes that we're talking about, any mistake that you could possibly make in Medicare, can all be avoided with the right education, with the right knowledge. It's out there. The last one is not working, obviously, with an experienced Medicare insurance broker. Let me help you make those smart decisions so that you can get into Medicare and have a smooth ride. When you make mistakes in the beginning, that ride gets so bumpy later on. And some of these mistakes, if you get into the wrong plan, sometimes you're stuck. And we don't want that for you. We want to be able in retirement to because our bodies wear out, we get older, we know that, we're going to go to the doctor. We want to make sure that we get the care that we need when we need it, and we want to know how much is it going to cost us, because we certainly don't want to have to dip into our retirement to pay for our health care when all of that could have been avoided and planned out properly. I want to thank you for taking your time today, learning the basics of Medicare. You've taken definitely a step in the right direction. Medicare is so complicated, it's confusing, and it is best done with an experienced advisor. Someone that understands your budget and retirement and that has a good understanding of your healthcare needs now and in the future. Next steps for you is to set up your consultation for a review of your personal Medicare plan options and a timeline. Get that timeline down so that no deadlines are missed. Remember, we do not charge a fee for any of our services, so this process is at no cost to you. Thank you, and we look forward to working with you soon.